Oh shit, is it on? Hey Cornerstone community! Instead of waiting Cornerstone doctor in the changing room like this is a foundational exercise I want you guys to do. If your foundational x-ray have hyperlordosis in the low back, this is the exercise I want you to do. We always measure this. Supposed to be between 35 to 45, but can you see this? 50. So your tailbone, everybody's facing this way, this is a side view, facing that way, and quite a bit hypercurvature is going on. This is the exercise I want you to do. Super easy. We don't want to create a hyper, so we gotta keep contracting this front side. So here we go. Boom. Easy. Hold it down. Make sure not too archy. Here. Hold it. Nice and tight for 20 seconds. Then you can do also side as well if you want to be advanced. So make sure that the heel is on the floor. Then make sure you're not super arching, but nice core right here. Thumb pointing backward and hold it down. Go like this. Make sure straight. Hold it down. Then of course you do opposite side as well. If your low back has a hyper going on, ideal angle for the base angle is 35 to 45. So if your angle is near 45 or maybe above 45, this is the good exercise you can do. You don't want to do hyper anymore, so we got a contracting here. So either you can do a door, beginners, or you can do a bench, intermediate right here. Make sure that it's not sagging here. 20 seconds. Then after 20 seconds, you can do side. Make sure the heel is on the floor, no twisting. Thumb pointing backward. Hold it nice and straight. That's 20 seconds. Then of course, opposite side. Going to be 20 seconds. Or you can do it for the floor. So what you can do is, here. Here. Hold it down. Hold it down. Hold it down. That's a good exercise to do. Or side. Here. Hold it down. Hold it down. Hold it down to keep your core tight. So you are not gonna do a hyper in the low back. Then of course you do opposite side. So that is the good foundational exercise for hyper low back for you. If your foundational x-ray has a hypo low back is going on, hypo means right here this number. Normal is about 35 to 45, so in this case 28.7. This is determining about the hypo low back, means stacked up a little bit too straight or no curvature is going on. So this is the exercise you can do. So get the wide stance like this. It needs to be wider, otherwise your tailbone not gonna tip. Then put the hands about the chest height. Then from here, what I want you to do is lean, 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 lean. Then tip that curvature furthermore. Breathe in, breathe out. Breathe in, breathe out. Then breathe in, breathe out. It takes about 20 seconds to recreate a little bit more curvature because your hypo low back is going on. If you have a hyper T, means especially the thoracic area has a hyper going on, like this in your foundational x-ray, then usually your neck going forward as well. This is an exercise you can do. Easy one is this. Put your finger on your shoulder, then make a big circle. Big circle, big circle, big circle. In this position, what I don't want you to do is do this. No, your core needs to be tight. Then do a big circle 10 times. Then after 10 times, you do squeezing your shoulder blade. Ideally, you don't want to look down. We want to look up and squeeze, 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 squeeze 10 times. That's the version 1. Advanced version is this. Interlace. Then from here, look up. Roll big time. Only backward. Only backward. going like this. Only backward 10 times. Then after that, squeeze 10 times. Squeeze, squeeze, squeeze. I don't want you to squeeze up. I want you to squeeze down, 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 down. So 10 times, roll backward and squeeze 10 times. Oh shit, is it on? Hey Cornerstone community, instead of waiting Cornerstone doctor in the changing room like this is a foundational exercise I want you guys to do. Another exercise you can do, this is really common area, so I'm gonna show you about the various area. You can use the doorway. So we all have a door, changing room has a door. So great exercise you can do is get the slightly wider than the shoulder width. Thumbs up is the good things. Thumb pointing backward. Then from here, lean to the door to open the hyper T area. Because we do this, right? Do this, do this. So open you up from here. Drop your chest forward. Y. Nice and easy. W. Nice and easy. You can shake it a little bit, shake it a little bit. Then small letter T. Look up, going in, your shoulder blade and the shoulder open up, nice and smooth. Hold it about 3 seconds for each. Then the reason why you want to do a thumbs up is this. So majority work we do nowadays is thumb pointing inside. Like this, or do this, or this. So we tend to do a thumbs in work, like shoulder going forward. But when you do thumbs up or thumbs out, your shoulder is coming back with you. So that's why it needs to be thumbs up. If you have a hypo, neck is going on in your foundational x-ray, this is an exercise you can do. Hypo means that we are supposed to have a forward curvature in your neck, but as you can see right here, this neck is either straight or bad case, you are almost like going to the reverse. So this is the exercise for the hypo or also reverse neck people. So I have a beginner's version, intermediate, and advanced. So this is the beginner's version. Here, wall, go against, then about the shoulder width or a little bit slightly wider. The main thing is that you look up, then lean to it. Breathe in, breathe out. Come on back. Lean to it, breathe in, breathe out. Come on back. Then, last one. Breathe in, breathe out. Then, shake it off. That's the beginner's version. Then if we want to do an intermediate version, this is something you can do. Again, interlace, look up, then key point is this. You want to open up furthermore. So from here, as you squeeze your shoulder blade, shoulder blade is squeezing down, but you're still looking up, looking up, looking up, looking up. So you are almost like pushing your neck this way. Then your shoulder blade is coming down. So that's the intermediate exercise. Then the last one is advanced. So go against the door. Thumbs up. Here. Then go wide. Then from here, I want you to stick your butt out just a little bit to slide down. Maybe a couple inches down. Then from here, what I want you to do is, I want you to breathe in, breathe out, and getting closer to wall. Shake it off. Stick your butt out a little bit. Slide down a couple inches. Then from here, get closer to the wall. Breathe in, breathe out. One last one. Shake it off. Here, stick your butt out. Slide down. Then coming closer to the wall. Breathe in, breathe out. So what's happening is we are extending your neck, but also at the same time, shoulder blade is coming back down to recreate the curvature back again. That's a hypo neck or reverse neck people. Boom. Oh shit, is it on? Hey Cornerstone community, instead of waiting Cornerstone doctor in the changing room like This is a foundational exercise I want you guys to do. In your foundational x-ray, if you have a PI, this is the exercise I want you to do. What PI means, by the way, if one side is PI, the other side is AS. If I explain it like this, so your hip is right here. Let's say this is a tight or painful or discomforting side, and let's say it's a PI. What happening is the PI means posterior inferior drop is going on, so your exercise needs to support that direction as well. And I'm going to explain what that is look like, but PI means hip is back and drop it down. Then after that, either it can go inside or excite. Excite means the outside. So PI means posterior inferior, so means back and down. Then after that, this hip can go internal or external, and I'm going to show you about the exercise. So your hip is back and down, so you want to actually bring it forward and up. So you can use the doorway, you can use the wall, you can use the bench to facilitate that. So this hip is dropping back and down. So what you want to do is get the support, then bring it forward, and up. So you can support that right here. Then you can feel the good stretch right here for the hip flexor. That's something you can do. If you have a PI, means back and down and the internal going on, means your hip is going in as well. You're going to encourage them to go external. So how it works is this. Your toe is pointing inside. So this is how you bringing your hip outside. Then from here, go like this. Then you feel the slightly outside of your hip as a stretch. Then if you have a PIEX, means hip is going back down and also out going on. Now you want to bring the hip going in. So you want to do toe out. From here, again, you feel the good stretch, a little bit more inside, then support here to open you up. Go like this, nice and easy, 20 seconds. If you have a AS in your foundational x-ray, this is the exercise you can do. AS means your hip is going anterior superior, so going up and forward, up and forward. Again, by the way, if one side is AS, the other side is the PI. It's a relatives. But anyhow, when we go up and forward, this is the exercise you can do to stabilize. This is not going to correct the foundational distortion, but it's going to support what we do. AS means your hip is going up and forward, up and forward. So we're going to pretty much, when we do a stretch, bring it down and backward. So this is easy. So sit at the edge of the chair, okay? Then you go like this. Keep your spine. Then almost like you keep from the spine nice and forward, straight. Then you just drop it down to bring this one down, 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 down. You feel the good stretch. So that is the pure AS. Then of course you do opposite side as well for 20 seconds and 20 seconds. So that's the pure version of AS. Finish with the start and finish with the affected side. If you have a AS-IN, IN means inside going on, so you want to bring it outside. So toe is slightly pointing about 5 degrees. Go like this. Keep your spine nice and this. Then try to reach. Don't bend your back. Nice and reach. Then this one, drop it down, down, down. Then, of course, 20 seconds and 20 seconds. Finish with the affected side. If you have a SEX, means anterior superior means go up and forward, right? Then also EX means external, so this is the exercise you can do. We want to bring it down and backward and going in. So here, edge of the chair, spine nice and straight. From here, what I want you to do is go in this to bring the hip, keep your spine nice and square. Then from here, going forward. From the hinge, no bending, here. Nice and easy. 20 seconds. 20 seconds. 20 seconds. If you have a S-I-N, means this is going up and forward, and I-N means in. This is something you can do additionally. So again, keep your spine nice and straight. Then you can do slightly toe in, slightly toe in to bring your hip outside. Then you do a nice stretch. Don't bend your spine like this. Keep your spine nice and straight and bring your hip down. Nice and easy, but toe is slightly pointing in. If you want to get the additional support, go like this. Nice. Butt going down the floor. 20 seconds. Of course, we do opposite side. 20 seconds. Okay. Then finish with the affected side. So here, here, here. Toe and breathe in. Breathe out for 20 seconds, 20 seconds, then finish with the affected side. If you have a S-E-X going on, what's happening is your hip is going up and forward. Your hip is going up and forward and external. So we want to bring it in. So what you can do is similar things. Keep your spine nice and straight. Okay, then here. Since it is going outside, what we want to do is toe out like this. Again, keep your everything nice and square. Then as you go in, then butt down. Again, we don't want to see this. Just drop your butt down right here. Then it's gonna, you feel the good. Slightly inside. When you do an external stretch, slightly outside, but this is more inside. You feel that. 20 seconds. Same. Here, slightly toe out, nice and easy. Then drop it down. Good stretch. Then finish with the affected side. Here, toe out. Here, butt down. Oh shit, is it on? Hey Cornerstone community! Instead of waiting Cornerstone doctor in the changing room like this is a foundational exercise I want you guys to do. So this is a foundational exercise for ASIN Advanced. This is a really common misalignment I often see, and as a matter of fact, I do have it on my right side as well. Common symptom you have is not only the back or hip pain, but also groin pain, or also inside of the knee pain. That's a really common ASIN as well. What's happening is your hip is going up and forward and also going in. In that case, what happens is your toes start to do this. So toe out is going on, and these are the people usually have a back side, back outside start to wearing out because you're walking like this. Then what you can see is buckling the knee, hyperpronating, so that's why easier to get the bunion or easier to collapse the arch on your foot, then end up is getting the plantar fasciitis. So this is the really advanced stretch you can do. So make sure your spine is nice and straight, okay? Make sure no bending over. Then here, so I'm bringing the hip down. Then also another thing you can do is from here going forward, about 12 o'clock, 10 seconds. Then also leaning away. Then when you do leaning away, you almost like a bringing the internal hip going outside. So go like this for 10 o'clock. Okay, you feel the good stretch in the glutes area. Then of course you change to the opposite side for 10 seconds. 10 seconds. Okay, then finish with the ASIN side right here. So going forward, 10 seconds. Then you go into this way for 20 seconds. So this is the advanced ASIN supportive stretching exercise. If you have a EX in your foundational x-ray, EX means your hip is going out. So your toe tend to go in. This is a little bit exaggeration. So you might be walking this way, EX. This side is the EX because hip is going out. With that being said, this side you easy to get tripped. Or this side you easy to get the inversion sprain. They end up is creating about the ankle instability. So this is the exercise you can do to stabilize. So you can use a cushion, or you can use a 2-stack of bath towel, or if you have a fancy schmancy wonderful balance board, you can use it as well. So for the purpose of demonstration, easy way, everybody has a cushion, I'm assuming. So you can do this. So step on the unstable ankle side on the cushion right here. Here we go. Then what you wanna do is pretty much you go back and forth, back and forth, back and forth, back and forth. I don't want to see that too much knee movement, but I want to see the ankle is go back and forth, back and forth, back and forth. 10 times. Then after that, you're going to go slowly side to side for 10 times. Of course, you want to use the wall to stabilize. Then you want to make a big circle for clockwise 10 times. Then counterclockwise for 10 times to stabilize your ankle joint. Because if you have an unstable ankle is going on, you are going to redo the inversion sprain back again. It's not going to stabilize about the EX pelvis area. So this is the recommended exercise. If you are so good at it, then maybe try not to count on the wall. If you are so good at it, close your eye and do a full range of motion. Go back and forth 10, side to side 10, clockwise and counterclockwise 10 and 10. Most important things that I want to see is that your ankle is going to be back and forth, then side to side, make the big circle, clockwise, counterclockwise to get the full range of motion for the ankle, to re-establish the stable ankle so that you are supporting about the hip joint. Oh shit! Is it on? Hey Cornerstone community! Instead of waiting Cornerstone doctor in the changing room like this is a foundational exercise I want you guys to do. This is a foundational exercise for your wrist and finger. In this current society, we use this, right? Or we hammer in this. So we tend to overuse the front side. Grabbing is going on, and including myself. I use my hands quite a bit for the patient care. So my hand get tighter. So this is a really good, easy way to opening up. So what you can do is grab the forefinger like this. Then from here, make sure elbow is nice and straight and go like this. Then once you get the good stretch, I want you to roll and roll to change the angle. Because that front side of the muscle start from here, then go all the way to the different angle. So I want you to do a little bit different angle to shake it off. If you want to do one by one, you can do so. Grab your finger like this, then go one by one. Go one by one. Keep your elbow straight, then go one by one. Okay, so that's the finger. Thumb is a different animal, so thumb web and thumb web right here. Straight, grab it, then pull it toward you. Open your finger as big as possible because this thumb web is going to the various direction. Opening is another way to stretch the adductor pollicis. So here we go. So grab it right here, open as wide as possible, then going in, going out, going in, going out. Another exercise you can do for the finger is this. Since we are in the changing room right here, there is a bench. You can go this way and you can go this way. Okay, make sure your spine is nice and straight. Go like this. Then continue to push your wrist down. Then after you feel the good stretch, you are supposed to feel the good stretch right here. Here. Then you can go side to side. When you go side to side, you feel the thumb side to the pinky side, thumb side to the pinky side. You can go that way as well. If you want to isolate, you can go a little bit more as well, but make sure that you are swinging. When you do swing, you can actually work on the different angle of the muscle. This is the exercise, foundational exercise for the foot, especially if you have a ASIN, means your hip is going up and forward and your toe going in. Now, if you walk like this, you end up is creating the bunion, kinked one. So this is the exercise, what you can do. Here, rubber band or strong rubber band. Here. It's almost like I call a skater position. so your hip is not compromised. Slightly 5 degree in, bend just a little bit, spine is nice and straight. Then as you go lift it up, this piece is lifting up. Make a wrinkle. If you have a paper, you can put it under, or tissue paper right here. The main things I want you to see is this joint, what we call metatarsal phalangeal joint right here, that one of the most easier to get the kinked area, is lifting up as we do this. Go up, go up, go up, go up, like that. So make sure that this piece is going up and contracting this, because usually SIN side you have a flat feet going on, collapsed arches going on, means that you might have a plantar fasciitis with bunion going on. So this foundational exercise gonna build your nice arch and the strength to build a good foundation of that.